Are you unsure if taking autoimmune medications rules you out for a regenerative medicine procedure? Let's break it down. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in treating musculoskeletal conditions, autoimmune diseases, and offering cutting-edge regenerative treatments. Today, we're diving into a critical topic. Can you safely pursue regenerative medicine treatments if you're taking autoimmune medications? Autoimmune diseases like rheumatoid arthritis, lupus, or psoriatic arthritis often require immunosuppressive medications to manage inflammation. At the same time, regenerative medicine using treatments like platelet-rich plasma, PRP, or bone marrow concentrate-derived stem cells has become a game changer for joint and soft tissue health. But many patients wonder, does taking immune-suppressing medication make regenerative treatments less effective or even unsafe? What about common anti-inflammatory medications like prednisone or NSAIDs? As a board-certified rheumatologist and someone who also specializes in regenerative medicine, I hear these questions frequently. In this video, I'll address these questions, explore the science, and explain how you can safely combine these therapies to get the best results. Autoimmune medications work by controlling an overactive immune system. These include drugs like methotrexate, TNF blockers, and newer biologics like interleukin-17 blockers. They're critical for managing inflammation and preventing long-term damage to your joints and organs. However, these medications can impact how your immune system heals and repairs tissue, raising questions about their effect on regenerative treatments. The key questions are, does being on these medications reduce the effectiveness of treatments like PRP or BMAC? Are there safety concerns when combining these approaches? What about common anti-inflammatory medications like prednisone or NSAIDs? Regenerative medicine uses your body's natural healing cells to repair damaged tissues. Treatments like PRP take platelets from your own blood and concentrate their growth factors. Bone marrow concentrate goes a step further by adding your own mesenchymal stem cells to promote healing. The long-term goal with these treatments is to reduce inflammation, improve tissue repair, and restore joint function without the need for surgery. The challenge is that these treatments do harness inflammation initially, which starts the normal healing process. On the other hand, autoimmune medications suppress chronic inflammation, so there is a possible conflict there. Let's first talk about prednisone and NSAIDs. Do they interfere with regenerative treatments? Prednisone. Prednisone is a corticosteroid often prescribed to acutely manage autoimmune diseases. While highly effective at reducing inflammation, it can affect the quality of regenerative medicine treatments. Platelet function. Prednisone has been shown to reduce the activity and effectiveness of platelets used in PRP. This means the growth factors responsible for tissue repair may be less potent if prednisone is active in your system. Tissue healing. Corticosteroids can impair the body's natural ability to heal by slowing down collagen production and weakening tissues over time. This doesn't mean you can't undergo regenerative treatments if you're using prednisone, but the timing and dosage must be carefully managed. I recommend tapering off steroids if possible before your regenerative medicine treatment. If you can do that 2 weeks before your treatment and stay off it for 2 to 4 weeks afterwards, that'll give you the best chance for a good result with treatment. NSAIDs, or non-steroidal anti-inflammatory drugs. These include medications like ibuprofen, Advil, naproxen, or meloxicam. These are commonly used to control pain and inflammation. However, they may interfere with regenerative treatments in the following ways. Platelet inhibition. NSAIDs can inhibit the ability of platelets to clot and release growth factors, potentially diminishing the effectiveness of PRP. Stem cell activity. There's some evidence that suggests that NSAIDs can reduce the anti-inflammatory and regenerative capacity of stem cells. though this effect is generally considered to be less significant than prednisone. So how do we address these challenges? For optimal results, I recommend the following. We may recommend tapering off prednisone or NSAIDs before treatment to improve the efficacy of PRP or bone marrow concentrate. For NSAIDs, I recommend being off for at least 1 week before your procedure and a minimum of 1 week after your procedure. If you can hold off NSAIDs for 1 month after your procedure, that is preferable. If tapering NSAIDs or prednisone is not possible, we may adjust the type and concentration of regenerative therapy to account for these medications. In some cases, we may use an alternative anti-inflammatory strategy, such as alpha-2 macroglobulin, which again comes from your own blood, to control pain without interfering with the regenerative process. The bottom line is that while these medications can diminish the effectiveness of regenerative medicine, with personalized planning, we can still achieve meaningful results. What about safety concerns? The good news, there is no direct evidence that being on autoimmune medications like methotrexate or biologics is unsafe when receiving regenerative treatments. Since PRP and bone marrow concentrate are derived from your own body, the risk of adverse reactions is minimal. However, it's essential to consider a few things. Infection risk. Autoimmune medications and prednisone can increase the susceptibility to infections. Maintaining a sterile environment during your procedure is critical. Delayed healing. Some medications may slow down the regenerative process, requiring adjustments to treatment timelines. What about the effectiveness of regenerative treatments? For patients on immune-suppressing medications, studies show mixed but encouraging results. Platelet quality. Medications like prednisone and NSAIDs can reduce platelet function, but many patients still experience significant improvements. Stem cell viability. While some biologics or NSAIDs may slightly alter stem cell activity, the overall effectiveness of treatments like bone marrow concentrate remains strong. My personal clinical experience shows that even patients on biologics, methotrexate, or low-dose prednisone often experience pain relief and functional improvements with regenerative medicine. In the case of biologic medications and disease-modifying treatments such as methotrexate, Plaquenil, Arava, sulfasalazine, and Imuran, controlling chronic inflammation is helpful and does not seem to negatively affect the outcome patients receive after a regenerative treatment. Not all autoimmune patients are the same. Here's how we decide if regenerative medicine is right for you. What's the severity of your condition? Are you stable on your medication, or is your autoimmune condition flaring? If flaring, I recommend getting that under control first before considering a regenerative medicine treatment. What's the type of treatment needed? If you have an autoimmune condition, for mild osteoarthritis or soft tissue injuries, PRP is a great first-line option. For more severe cases, like more advanced arthritis, bone marrow concentrate may be necessary and can still benefit patients with chronic autoimmune issues. What about your current medications? We'll evaluate whether your immune medications, prednisone or NSAIDs, might affect platelet or stem cell function and adjust accordingly. So how do we optimize your outcomes? If you're considering regenerative medicine while on autoimmune medications, here's what you can do to maximize success. Try to keep your condition stable. Ensure your autoimmune condition is well controlled before treatment. Taper medications if possible. If appropriate, we may recommend adjusting your prednisone or NSAIDs before your procedure. Communicate with your physician. Be upfront about your medications and health history. And follow post-treatment recommendations and care closely. Adhering to recovery protocols can help you achieve the best outcomes. So, is the use of prednisone, NSAIDs, or autoimmune medications an absolute contraindication to regenerative medicine? The answer is no, but these medications require careful management to ensure the best results. With thoughtful planning and personalized care, many patients find meaningful relief through regenerative medicine, even while managing autoimmune conditions. My overall recommendation, if you're on some of these medications, is try to taper off steroids and try to stop the anti-inflammatory medications like NSAIDs for at least a week before and a week after treatment. If you can go longer than a month after your treatment, that's preferable. If you're taking a chronic medication like a biologic or disease-modifying treatment, like methotrexate, Plaquenil, Arava, Imuran, sulfasalazine, it's okay to continue those. They help to control your overall chronic inflammation, and in my personal experience, don't seem to affect the effectiveness of a regenerative medicine treatment for treating your osteoarthritis or tendinitis issue. If you have questions about your specific situation, contact us at Chicago Arthritis and Regenerative Medicine. Let's create a customized treatment plan to help you achieve your health goals. Thank you for joining me today. If you found this information helpful, please like, subscribe, and share. For more insights, visit us at chicagoarthritis.com or reach out directly. Until next time, stay healthy and live well.